we are now using more and more as frontline treatment, as induction therapy, quadruplet combination, and there are different quadruplet combinations. Some of them are based on bortezomib as a backbone, the VRD CD38 antibody regimen, or the VTD plus a CD38 antibody, and we can also use carfilzomib-based quadruplet combinations. With carfilzomib, we can use KRD, carfil, KRD, daratumumab, or KRD isatuximab. So probably those two combinations with KRD dara or KRD isatuximab are the most potent combinations before autologous stem cell transplantation. Unfortunately, those two combinations are not yet officially approved, and we cannot use them outside clinical trials. The MIDAS study was presented for the first time during the International Myeloma Workshop 2024 in Rio de Janeiro. And this is a very large study who did enroll almost 800 patients. All patients did receive a quadruplet combination with KRD plus isatuximab. And subsequently, we systematically assess minimal residual disease within the bone marrow with a threshold of 10 to the minus 5. And then when patients were MRD negative, they were considered as good risk patients because they did achieve a very deep, very good response. And we did compare KRD isatuximab alone versus autologous stem cell transplantation. And for those patients that were remaining MRD positive, what we are considering as high risk, poor risk, because there were still a minimal residual disease positivity after a very strong induction, we have compared a single versus a tandem autologous stem cell transplantation. So here in Rio, we have heard about the first part of the treatment, the induction results. And MIDAS is one of the first study looking at the adaptation of the treatment according to the results of MRD negativity. So MIDAS means minimal residual disease adapted strategy for young patients eligible for autologous stem cell transplantation. So the results are outstanding in terms of MRD negativity rates. The depth of response is really incredibly high after 6 cycles of KRD plus isatuximab, showing again that this quadruplet combination is very, very active, in fact. We are reaching 60% of MRD negativity at 10 to the minus 5 in the intent to treat analysis. And we also looked at a deeper response, 10 to the minus 6, and we have more than 40% of the patients that are reaching 10 to the minus 6. So outstanding response rates showing that this quad combination is very, very active, in fact. What is important to note is that the death rate is very, very low, in fact. So the feasibility of the quadruplet combination, 6 cycles, 28-day cycles, 6 cycles upfront, is very feasible. And from a safety point of view, we didn't have any issue, in fact. So for patients less than 66 years of age, definitely we can use in routine this quadruplet combination to achieve very good responses. So now we have to wait for a longer follow-up to have the updated results for the current comparison of stem cell transplantation versus no stem cell transplantation for patients with a good risk, and for patients with the poor risk group, we need as well to wait for single versus tandem stem cell transplantation. So the study is still ongoing. That was the first report of this induction phase, but we need a longer follow-up to look at the final outcome and progression-free survival. So we will need more time definitely. So, but this study is really showing that in routine, in fact, you can adapt the treatment probably according to MRD negativity after induction in the future. The CONCEPT study is a German study that started quite a long time ago now, in fact, and this German group was one of the first to propose a phase 2 study focusing on patients with high-risk disease. In the CONCEPT study, our colleagues did enroll not only young patients, but also elderly patients, but few patients were elderly. So let's focus on young patients that are really the majority of the patients enrolled in this large phase 2 because almost 150 patients were enrolled. The idea is to use a very aggressive quadruplet combination, stem cell transplantation, and a long duration of consolidation and maintenance in order to avoid early relapses. So the German group is showing that the quadruplet combination upfront, and again, that's KRd plus isatuximab, so carfilzomib, lenalidomide, dexamethasone, and isatuximab, before stem cell transplantation is associated with a very high rate of MRD negativity, above 50% as well, 10 to the minus 5. So the results are very similar to that was described in the MIDAS study. MIDAS, maybe the response rate is slightly higher, but nevertheless, that patients are all of them receiving stem cell transplantation. And the difference here in this phase 2 is that they are proposing a consolidation based on carfilzomib, lenalidomide, isatuximab, a strong one, and then a long duration of maintenance with carfilzomib and isatuximab. So the goal here is to have a strong induction and then a long treatment duration. The treatment duration is almost 3 years, so that you are really reducing the risk of relapse for this high-risk patients. So we don't have a lot of studies focusing on high risk. Published recently, we only have 3 trials that looked at high-risk patients, one from UK, one from France, and the CONCEPT study from Germany. So when you're looking at the overall results that were updated after quite a long follow-up now during the International Myeloma workshop in Rio in 2024, you see that the progression-free survival is very good for this poor prognostic subgroup of patients, with a median PFS that is not reached at 6 years. So those results are really unprecedented in terms of efficacy. We have to keep in mind that the treatment is very aggressive and very long indeed, but nevertheless, this is really showing that for high-risk patients, we need to use a quadruplet upfront and to have a long treatment duration.